Welcome to Better Health, Better Life. This is the show where we connect you with the best local healthcare providers so you can make informed decisions and stay fabulous, Sun City. I'm your host, Carrie Dillon. We have a great show for you today. We're going to be joined by Bishop Eye Associates and Beaufort Memorial. Stay tuned. Welcome to the show. We are joined now by Dr. Trey Bishop from Bishop Eye Associates. It's so good to have you back.
Well, thank you. It's nice to be here.
And today we're going to be talking, of course, about eyes. And I like harping on reminding folks that their annual eye exam is the most important, one of the most important things that they can possibly do.
Absolutely.
But today we're going to be talking about cataracts and cataract surgery. What is cataract surgery?
Well, basically, if we start with the definition of a cataract is a clouding of our natural lens. A healthy lens should be clear and provide nice vision. And as we age, that clear lens typically becomes cloudy and starts to interfere with vision. And the typical goal of cataract surgery is to remove that cloudy lens, replace it with a new artificial lens, and restore that sight.
And what is refractive cataract surgery?
Refractive cataract surgery adds the goal of attempting to make patients independent of glasses and contacts to various degrees. So the goal of all cataract surgeries is safe, effective, removal of the lens, insertion of an artificial lens. But traditionally, it didn't matter whether patients wore glasses or not. With refractive cataract surgery, we're using advanced techniques and technologies to truly achieve spectacle independence to varying degrees, depending on the patient's interests.
So are all cataract surgeries the same?
Absolutely not. So the fundamental goal is very similar, but there are tremendous ranges of patients, tremendous ranges of technologies that are used, a wide variety of experience with the different technologies, and then the different techniques and lens implants and such. So it's not necessarily apples to apples.
Sure.
It can be apples to oranges.
Can you talk a little bit more, elaborate a little bit more about the different types of surgeries?
Right. So, basically, I presume you're referring to the new advances to the surgery. So one such advance that we adopted several years ago was femtosecond laser-assisted cataract surgery. Now that's becoming more commonly used, but at the time we were the third practice in South Carolina to adopt that technology, and that allows us to customize visualization of the eye with imaging, allows us to customize incisions with a laser instead of manually, allows greater accuracy and precision, and just as importantly allows us to pre-treat the cataract prior to removing it with ultrasound. So it makes for a more gentle surgery in some of those patients with more mature cataracts. We've continually improve the multifocal lens technology. The first multifocal lenses that were widely used were manufactured by Alcon in 2005. They had some limitations, but we judiciously used them for the appropriate patients. Really restricted whom I thought was a good candidate for such multifocal lenses. Well, they evolved in 2007 and 2009, came out with newer models. In 2011, a competing company, AMO, came out with their multifocal lens, which really opened the door to more patients, more user-friendly lens, and then lately, that same company just came out with two new models earlier this year that are really just blowing us away. They're just amazing at how well patients are adapting, the quality of the vision at distance and near and intermediate, which has been limited in some of the past models. And then, if you talk to some patients or you look on the website, you see about halos and glare with multifocals, and that used to be a challenge for some patients. And with our latest lens implants, we're seeing very, very little of that, actually statistically equal to or less than some of our monofocal lenses. So that technology has dramatically improved and will continue to improve. And I think the other biggest thing that Dr. Schultz and I see on a daily basis is our constant attempt to perfect our astigmatism treatments. So Now we have the LensX laser available to treat low amounts of astigmatism. We have 2 different companies that make a wide variety of different lenses to treat different amounts of astigmatism. So those are probably the big 3 advances that we've seen.
Okay. And what distinguishes Bishop Eye Associates as a center for excellence for refractive
I like that
cataract
question.
surgery?
Did I write that? So basically, I think it really comes down to 3 things. I think it's experience, and I think it's passion, and I think it's compassion. So let me start with the 3rd one.
Sure.
We have all these technologies. Some incur extra expense, but our mission is truly to provide the best vision independent of the patient. We want the best vision for each individual. Obviously, we see some patients that don't have many resources and can't afford some of these technologies. We're willing to work with them. We even donate many of our laser cataract surgeries to patients that truly need it and can't afford it. Fortunately, we're blessed with many patients who can have the resources to opt for these. But just because you have resources to be able to afford some of these bells and whistles doesn't mean you truly benefit from them. So it's our job to truly customize the approach, see what the patient's interests are, and then match our technologies to those patients. And then if money is an issue, we work with them.
Sure.
Next is our passion. Dr. Schultz is always kind of laughing at me because I'm constantly striving to get the perfect result. And as we know, perfection in medicine is not necessarily attainable, but we can get darn close.
Yeah.
And so we're constantly buying new technologies. I mean, we just upgraded our topography systems last year, even though we didn't need to. We just brought new OCTs and cameras, even though we didn't need to. But this is constantly trying to improve our technologies, give us the ability to split hairs, and we really enjoy that. And hopefully that is portrayed in our discussion with our patients. And then lastly, it's our experience. I mean, I mentioned that we were the 3rd practice in South Carolina to have the femtosecond technology. And so Dr. Schultz and I have now performed nearly 2,000 femtosecond assisted laser cataract surgeries. And you know, many of our colleagues in the area are just now adopting it. I would say our experience eclipses all the other practices combined. And that's not to pat ourselves on the back, but that's just our passion. We were early adopters and we judiciously use it, but given our interest in our patient population, has given us a tremendous amount of experience to see when it's appropriate, when it's recommended, and when it's maybe not necessary. And
Sure.
so being able to bring that to the patient, say, hey, you benefit from LensX laser, you don't really benefit, so you maybe should consider incurring the expense, and maybe you save that expense. That's a tremendous benefit to our patients, and as a result, a benefit to us because we can truly customize our treatments.
Absolutely.
So,
now, how does a patient decide if refractive cataract surgery is the right choice for them?
right, so very good question. So, you know, first of all, a patient needs to be comfortable with their diagnosis. And then I think it behooves the patient to become educated on the various options and then understand which options are appropriate to consider and why. So if in talking with your surgeon you have really good rapport and you understand what I just mentioned, then I think you can feel very confident in proceeding with cataract surgery. And whether you elevate the goals of the traditional cataract surgery to truly achieving independence from spectacles, whether it's distance or distance and near, or intermediate and near and distance, then as long as you've done your homework, you have good rapport, you feel confident, then you can truly make that decision. You know, if we're talking specifically about a multifocal lens, and we always use our femtosecond laser to implement our multifocal lenses, we want a patient who has very healthy eyes, so there's no compromise to the results. We do not want to use a multifocal lens in a patient, say, with moderate to advanced glaucoma. They're not going to get the results they want. They're really going to benefit from a monofocal lens. So back to a multifocal, we want very healthy eyes. We want a patient who's very active, and bottom line, also a patient who's very motivated. because if a patient is really more comfortable with glasses and reading glasses and doesn't want to go the extra effort to a multifocal, well, we're certainly not going to push them.
Sure.
So, you know, sitting down, understanding your diagnosis, understanding the options, establishing rapport, and then making a well-informed decision allows you to decide what type of cataract surgery you want, what type of lens implant you want, and then you can be very confident that cataract surgery in general is one of the very safest procedures performed worldwide. So
I think it goes back to establishing your annual exam and making sure that that's taken care of, but also just getting to know your doctors and getting a consultation. I mean,
Right.
folks won't be in better hands than with the people here at Bishop Eye Associates. I mean, you guys are just top of the line.
Well, thank you.
And
we work hard.
You do indeed. And so make sure that you get in touch with Bishop Eye Associates and set something up as soon as possible for that annual eye exam and also for a consultation if you're considering cataract surgery.